Okay, hello everyone. Today's video is about how I actually got diagnosed with kidney disease. So before I tell the story, I want everyone to know, if you don't know already, there are 5 stages of kidney disease. One moment. And I was diagnosed at stage 5, and my kidneys were functioning at 4%. And I was 47 when I got diagnosed. I'll be 50 years old here in a few months. So I went through life in stages 1, 2, 3, 4 without knowing anything at all. And looking back, I estimate I was in stage 1 kidney failure in my late 20s. And I estimate that I was in stages 2 and 3 in my 30s. And in my 40s, I was in stages 4 and then obviously 5. So looking back, the only issues I had, I was feeling tired. The first time I took a nap as an adult during the day, it was my late 20s. And I figured I was just getting older. And in my 30s, taking a nap every day after work was a common thing. It became more common. I was still very active. I would jog 5 miles in 1 hour after work. I played full court basketball, but I was a little tired. And again, I just thought, well, that's just a sign of getting older. And then same thing in my 40s. When I would work, I'd come home from work, and the first thing I wanted to do was eat and lie down and take a nap. But again, I just thought I was getting older. And so the job that I had, we normally worked 8-hour shifts. And then due to lack of staffing, we had to now work 12-hour shifts. So I was working 6 a.m. to 6 p.m. And then suddenly the boss came up to me and said, "Hey, we need you to work night shift. We need you 6 p.m. to 6 a.m." So it was a complete flip-flop in work schedule. And so I remember that first week having to stay up all night, which I've never done in my entire life. It was hard. It was hard. And even crazier, it was hard for me to sleep during the day. And I even went out and bought a blackout shade for my bedroom window. Still didn't work. So I scheduled an appointment with the doctor, and I asked for sleeping pills to help me adjust to this new schedule. Again, I was working 6 a.m. to 6 p.m., now 6 p.m. to 6 a.m. And so the doctor gave me some sleeping pills, and she asked for a blood and urine sample, which I provided. And the next day, the doctor called me, and her voice was kind of panicky, and she said, "Where are you? What are you doing?" I told her I was at home, just sitting on the sofa. It was my day off. She said, "We need you to come to the hospital now." And so I did. I walked in, they drew blood, did not tell me anything. I went right back home, and my doctor called to, "Hey, I scheduled an appointment for you to see a specialist." And this was on a Friday. The appointment was for the following Tuesday. So, 5 days later? And so Tuesday arrived, and at this point I felt really well because the sleeping pills were working. I was sleeping great. I was up all night, no problem, sleeping all day, no problem, and I almost canceled that appointment. But I said no, I went to the appointment out of respect for the doctor because she took time to make the appointment for me. And so I get there, and this doctor's office was about 30 minutes away from my house, and so I normally don't get out that far. I live in the middle of a city, everything is close to me, and so I drive 30 minutes to this doctor's office. And I remember pulling into the parking lot, and the first thing I saw was a sign, big red letters, kidney care. And that was the first clue that I had. So I get out, walk in, and as soon as I walk in, they gave me a little cup, said, hey, we need a urine sample. I gave it to them. Then they walked me into a small little room, like a little 12 by 12 room. I'm sitting there by myself for a few minutes. The doctor walks in, and very calm, she sat down in front of her computer, pulled it up, and she said, you have stage 5 kidney disease. Your kidneys are functioning at 4%. Very calm. And my response was to be very calm. I really was clueless. And I'm thinking at this point, she's going to prescribe medication to me, and then I'm just going to go about my life. I now have to take medication. And she said, well, it's a little bit more than that. And she asked me a few questions. How are you feeling? And she felt my hands, and she wanted to see my feet. What she was looking for was edema, swelling of the hands and the feet, and there was none of that. And she put her hands, she had me remove my shirt, she put her hands on my stomach, and she says, oh, I am very positive you have polycystic kidney disease. And okay, so I'm not concerned at this point. I'm like, okay. And she said, I'm gonna have you go in this evening to get an x-ray done. I want to see the inside of your body. And so later that day I went and got an x-ray done, and this was like, again, this is Tuesday, and then that Friday, with 3 days later, they called me and said, hey, we have you scheduled for Thursday, Monday morning, 8:30. And didn't tell me anything. I said, well, what kind of surgery? And they said, oh, it's a minor surgery. And I said, well, I normally work that day. They said, well, no, you're not gonna be able to work that day. And I said, well, will I be able to go into work on Tuesday the next day? They said, oh yeah, no problem. I said, okay. So obviously, I call in sick on Monday. I show up to the hospital 8:30, thinking minor surgery. I woke up, I guess it was about 11 or noon. I woke up and I didn't feel any different. And then I looked down, I saw this tube coming out of my lower abdomen. And I asked, what is this tube? And they said, oh, you're going to be doing peritoneal dialysis. Peritoneal dialysis. I never heard the word before. I heard the word dialysis, but I wasn't all that familiar with it. So, and I felt fine. I walked out of the hospital. My wife drove me home, and I went to bed that night. I'm thinking I'm just going to go to work Tuesday night as normal. But Tuesday morning, I was extremely sore. It took all my strength to get up out of the bed. My entire front side, it's like I had done 1,000 sit-ups. I was very sore. and I struggled to get out of bed. And I said, there is no way I can go to work. And so I never worked again. And the following Monday, I started training. I went to the dialysis clinic, and they started teaching me how to do peritoneal dialysis at home. And so the training wasn't hard. They provided me with everything. The nurse came to my home and set everything up. And the nurse is also on 24/7 call. And there were a few times I had to call because I had an issue. And I remember one time I called, it was about midnight. She picked up right away. And so after about 1 year of peritoneal dialysis, it was no longer effective for me. And so they transitioned me to hemodialysis. And you can see the scars right here. This is where the first, the vascular access line was initially put in. Because when they put one in here, a patient can immediately begin to use it right away. And so they trained me how to do hemodialysis at home. This involved me going into the dialysis clinic every day for 3 weeks, teaching me how to use this machine. And the first week was very confusing. I thought I was going to be a dead man. And the second week, my brain was picking up the steps. And then the third week, yes, I was confident I had it. And then they came and set it up here. And the first day of doing hemodialysis at home, the nurse sat here in my living room with me and observed the entire session. She did not interfere. She just wanted to make sure I knew how to do everything on my own. And also, that nurse is a different nurse that handled the hemodialysis. She is also on call 24/7. And so that's good. And if there's any issues with the dialysis machine, the company that handles the machine, their tech support is 24/7, and they really do pick up on the first ring. Very impressive. And they can talk you through any issue a patient might have. And I've had to call a few times for issues, and they were amazing. So that is the story of how I got diagnosed. I was just a normal guy, working guy, and I really didn't have any of the symptoms other than just being really, really tired. And if anything, I have my employer to thank by switching me to night shift. The symptom, being tired, really got more emphasized. And because had I not gone to the doctor told me that I would have passed away in my sleep of a heart attack probably in 1 or 2 months. Probably in 1 or 2 months. Because when we're sleeping, that's when our heart is beating the slowest, and I just would not have woken up. So, anyways, that's it. And so I hope you enjoyed the video. And obviously, if you have any questions, just put them in the comments. I'll reply. And other than that, take care of yourself and have a nice day.